the treatment of latent TB, latent MDR-TB, and also asymptomatic TB, prophylactic treatment in some situations. What did you make of those comments?
Yeah, I think it's really interesting. You know, that was actually one of the first articles that I've seen that Dr. Brostrom co-authored there in Micronesia, and I actually think it could represent a paradigm shift for how we approach prevention of MDR-TB. Now, of course, their experience there was somewhat unique. The island is very small, it's a very self-contained population, and they were involved right from the beginning of the outbreak. But I still actually think that there's some really exciting findings that might be able to be applied to the real world setting.
Now, if you have the capacity to do it, what, in your opinion, should be done then?
Well, the regimen is actually quite simple, you know, and the fluoroquinolone antibiotics, which were used to treat the contacts, is pretty easily tolerated. So I actually think that it could be done for specific risk groups. For example, children less than the age of 5 who are direct contacts to an MDR-TB patient, an elderly person who lives in the home who's a direct contact, or perhaps in a closed setting such as a prison where you have an MDR-TB outbreak. That might be another very effective way to deal with treatment of an outbreak, both by targeting the people who have active disease as well as treating all the reservoir, essentially, the people who are actually in contact with the patients themselves.